Welcome back to BBB Sharing. I'm Evie, Director of Ignite, sparked by BBB. We are here in the Ignite podcast studio, once again with our CEO, Barry Moore.
How you doing, Evie?
Hi,
This is going to be a good interview.
Since we've been in the podcast studio together.
We have got good mojo going, and we broke it up for months. But since we moved into
Well, we
office,
moved. We had an excuse. We had a valid.
it's been a long 5 or 6 months. But what a great place for you and I to do a joint interview with the CEO. You can introduce him, but it's exciting. I've known him for 16, 17 years, as we've been talking about.
Christopher Lindsay, COO, Virginia Department of Health.
Right on. Good afternoon. Glad to be here. What a great environment y'all have to do. This is so professional.
It is professional. Well, I think Barry did a really good job. Coming from a broadcast journalism background, I was very happy with this setup.
Compared to what we used to have.
Right.
We've come a long way, baby.
This is not what I expected. I'm very thrilled to be a part of this right now.
Well, thank you for being here. So Barry says I need to learn a lot from you. So I guess we'll go ahead and start with, what do you do?
Interesting. So professionally, as you said, Chief Operating Officer for the Virginia Department of Health. VDH, Virginia Department of Health, is an incredible organization that touches every single Virginian every single day, many times, multiple times a day. And so you think about who might have interacted with VDH today. If you drank water and didn't worry if it was clean from a municipal drinking system, pretty much anywhere in the state, VDH oversaw that drinking water regulatory environment. If you ate in a restaurant, VDH is inspecting those restaurants. If you saw an ambulance going down the road, VDH oversees the Office of Emergency Medical Services. If you heard about a fatality, it was a homicide or a drug overdose, our Office of the Chief Medical Examiner does that autopsy and investigates that death. If you got an immunization or you had a disease that needed to be traced through a respiratory or foodborne illness, VDH inspectors and VDH teams of epidemiologists do all of that. If you visited a local health department, had your STD testing done, VDH likely did that. If you are concerned about maternal health services and need to talk to someone about breastfeeding programs, VDH has teams of folks that do that. The list goes on and on. If you've got if you have a private well that needs a permit, VDH does that. If you have a drain field that needs to be installed through a new home building process, VDH does that. And the list goes on and on. We've got almost 5,000 FTEs and contractors across the Commonwealth of Virginia. This upcoming, the fiscal year in which we're in now, is a $1.3 billion budget that we administer all over the Commonwealth. So really and truly does touch every single Virginian every single day.
So, and Evie doesn't know your background a little bit, but I'm curious if you could talk about, you're the COO, VDH, getting all the acronyms right, and Jenny Kelly, we know her,
Right.
and I'm a fan. And so who did you replace as COO?
Nobody.
How can that be?
Well, the governor that I'm appointed under, Governor Glenn Youngkin, he and the Secretary of Health at the time, a gentleman named John Littell, who's now the governor's chief of staff, saw that VDH had some opportunity to have some more business accountability processes brought into the state agency. And so just over 3 years ago, my position was actually created. I was an appointed chief operating officer. I've got an extensive background in healthcare administration and clinically in emergency medical services. And so I was able to come in and jump in with both feet to look for opportunities to provide more efficiency in state government, to be more accountable for management practices, which ultimately leads to better spending of state and federal dollars. And I think bring some pretty good processes to people management, process management, and running a much more efficient, compliant VDH.
I think that's actually wonderful to hear because I just had a conversation with a recruiting officer today, and she was saying that a lot of people that are coming from big companies, they're going to smaller businesses and they're noticing that a lot of things are falling through the cracks because they don't have anybody holding those details accountable, or those people that are supposed to be required to keep track of those details accountable. So having that role, because we've had a lot of people from the Virginia Department of Health come and interview, I think an epidemiologist. And
It was all through Chris's department.
perfect.
You never met. Yeah, I didn't even put that together. He's been a big help.
Yes, I enjoyed those interviews a lot because I noticed that there are a lot of people that don't know all of the services that you all have to offer. So I think that's wonderful.
Good point. Was Jeff
Stover.
You connected me with,
Correct.
and he has been great.
I believe Lori Prolano came,
Yeah.
participated, a state epidemiologist. Yes.
He was brilliant.
Yeah, she is.
Way over my head. I couldn't even spell that word, but So you take a young man like you, and you are young, your background, your education, you're very well educated. You figure things out quickly and you became a true leader. What, all those skills, will there be another COO of the Department of Health? Well, I guess we're gonna find out.
Well, that's really up to the next administration. And I do believe that there will be. I do believe that I have demonstrated the value of a position like this. It was
Yeah.
noted in JLARC's report. So JLARC is a Joint Legislative Audit and Review Committee. It's the investigative, they call them the watchdog of the legislature. Did a big report on an agency 2 years ago, and one of their recommendations is that a COO being established, what they call classified, which means a permanent position within the Department of Health. So I believe that the next administration will work towards that.
And knowing you through this whole period and hearing things you do and then the things Evie talked about bringing guests in through your department has been a big help. We focus on, Evie runs the Ignite program, mental health, it's a big deal for us. Financial literacy, the fentanyl, Jason Miraz and everything he's been in here, he's done a couple podcasts with us as Attorney General. And Carl Leonard, we've talked about the fentanyl and everything, and there's so much that's been going on in our society, mental health wise. I always quickly note, because I love it, and you're on audio, or you're on visual, your pin, can you go like that for me on your lapel? Everybody, so a lot of citizens know it more than, they've been around for decades, maybe 120 years, but this governor designed this one. Every governor designs their own pin, so you're recognized as a state employee, correct?
As an appointee of the governor, that's correct.
So for me on the Fair Housing Board, Kelly G was I got on that, so I get the same pin. So I guess it gets redesigned by the next governor. I'm sorry, you're not going to be getting one, but I stay on, so I'm going to get the new one. Sorry.
If you're reappointed by the next governor,
I will be. It's automatic, I believe, unless they don't like you, I guess. So we'll find out.
I wish you will.
Yeah, I wish you will. So this is what I want to talk about. The Better Business Bureau, we work on integrity, respect, honesty. We just want everybody to be as truthful and honest as possible. We check businesses and we follow complaints. We follow reviews. So I want to talk about one of the big issues, and it's a broad one: home health care, hospice, and nursing home care.
Okay.
We're talking about the end of people's lives for the most part. I went through it with my father. You knew me back then in 2013. A facility put him out quickly. And so I look back, what have we accomplished? Because I see the news, it's atrocious what goes on. And before you answer, I want to be fair. Who wants to do the work taking care of my dad when he had Alzheimer's? When you could punch you need a diaper, shower, and you're making $12, $13 an hour, working a lot of hours, staff is small. How do we fix the problem? But I don't know if you have that answer in your mind, but I'll let you take it from there.
Barry, I appreciate the question, and I have a lot to say on that and the work that we've done, but I want to start by acknowledging a point that you just made. The people working in these facilities have incredibly hard jobs.
Yes.
It's incredibly hard to go to work every day and do what they do. So I want to caveat what I'm going to say with God bless those people.
And I appreciate you saying that, because even right here with 6 or 7 employees, some of us might walk in some days and think we have the worst job in the world. And they have no idea what's on the other side. Sometimes you got to look on the other side. And we have a crew that does walk in and likes what they do. But we talk about this often because we represent businesses. We're trying to get businesses to get their employees to appreciate them having a job and make sure they take care of them. So go ahead with your answer.
But to your point about, frankly, atrocious care in some of these environments, it is ultimately the responsibility of the administrators and the owners of these nursing homes across Virginia to provide high quality, safe care. Full stop. It is their responsibility. And what we found through the process that we have over the last couple of years is that so many of these nursing homes are owned by large private equity funds that are managed out of state. There's shell companies that own them. There's real estate companies that sit beside them. And so much of that money goes not to patient care, but to the bottom line of many of these nursing home ownership groups outside of the state. And that's something we need to really be taking a look at. What can I control? As a COO of the Virginia Department of Health, what can I control? One of the aspects that I did not mention in my introduction, that VDH is the regulatory authority for every single hospital in Virginia, ambulatory surgery center in Virginia, every single nursing home, every hospice organization, every home care organization. So I literally have teams of folks in what's called the Office of Licensure and Certification. Their headquarters is just over here, this side of Gaskins Road, so not far from here. OLC's responsibility is to ensure that these home care, nursing homes, hospice, and hospitals are providing that safe, high-quality care. How do we do that? By having teams of inspectors, medical facilities inspectors that go into these organizations doing proactive surveys in response to complaints. Now, what we found in this process, up to about 6 months ago, that office was 40+% understaffed. Vacancy rate over 40%. The team of inspectors that go out and inspect nursing homes had over a 40% vacancy rate just in that team. And those have been long-standing vacancies. I'm talking about years that purposely they had not been filled. Up until about 6 months ago, we had to do some incredible rebuilding of our Office of Human Resources, Office of Financial Management, change the way that we administered federal dollars coming into Virginia from CMS and other organizations. We had to build up the infrastructure, the environment on the administrative side of the house that then allowed us to pivot in July to really reforming the way that that office administers oversight nursing homes and other facilities. I'm really proud to say I had the opportunity to sit in front of Governor Youngkin the first week of August. We put together a plan of how we're going to correct this, how we're going to make this change. And just last week, I was able to sit in front of a camera with CBS News and report that I'm down to, at that point, it was a 9% vacancy rate. As of yesterday, it's a 6.9% vacancy rate specific to long-term care inspectors. I've hired across that office 40 individuals, including a new leadership team, a new director in the last 6 months. And that was all part of the Executive Order 52. We're going to be doing a celebration at the Patrick Henry Building with the governor and much of the leadership team, celebrating the wins of these fantastic leaders and individuals that we brought in, not only hiring new people, filling out teams, bringing in new leadership, changing processes, increasing technology so that citizens, patients, and providers now have an avenue to appropriately report complaints, have follow-up on those complaints, and our teams can triage them, get in the field, because the more people I have in the field being present, holding facilities accountable, ultimately, that's going to lead to safer, higher quality patient care.
It's a great answer. And Evie, you probably never been through nursing home care for family members yet?
No.
And it is for Alzheimer's. I've been through it with a grandfather, my father. My wife swears that's going to be me, and it might be starting, she said. But it is, you got to joke about it because Alzheimer's will eat you alive. I always said, I'll take cancer before I take Alzheimer's, and well, God gave me the cancer twice, so that worked out all right. Alzheimer's is tough. It really, truly is.
I didn't realize how bad the situation was because I grew up, my family background is Greek. And so I grew up in a culture where we all took care of each other. Even my grandparents that were struggling from long-term illnesses, they had their sons or their daughters taking care of them. So it never really connected with me that that was such a serious issue until I started working here and I started talking to professionals that worked in healthcare. I started talking to people like you. And that's when I realized that not everybody has family members that can either devote that time to them or can afford to provide them that level of care that they need.
And those workers have to feed the people. I mean, I'm going through in my mind everything that they had to do. Now, Kristen, you got 1 week left, right, at the regime. First of all, how is your boss? Did you give him an A plus?
With Glenn Young?
Well, your main boss.
I'd give him an A plus.
I give him A plus plus. I think he's changed some things in our state. We've progressed, and I think everybody gets nervous when you say the word progress when you talk about a Republican, because that's only on the Democratic side. But I think the new governor coming in will keep a lot of things in place in your area. I hope that's the case, and because we've made so much progress in a couple of years. But you have 1 week left. All right, so I ask families all the time on my advertising, why would you put a family member in in a nursing home or home health care, why would you let somebody into your home before you go to bbb.org and check them out? So imagine in the future, and if we could figure this out over the next 6 days, you'll really be my hero. But you can't make businesses become accredited. Plus, we don't accredit all of them. But we've had a couple doctor situations, breast cancer doctors, right? That were not real doctors. Am I saying the right way? Or
I'm not sure what you're referring to, but
okay,
it certainly seems feasible.
yeah, there's a couple in the news that I've been hearing about. So I wonder if those practices would have been at bbb.org. Would we have picked up on that sooner than later? I know there's somebody down the beach who was just in the news today. There's some really bad players out there. It's a bad world in a lot of ways. So imagine if nursing homes could be out of BBB. And so we're going to have to make a full attempt over the next year to get them. And maybe when you retire, you can go and visit them all with me and tell them, because we work hand in hand. Debbie Johnson's at Serenity First is an accredited business. She does it right. You know that, and I know that. Jay Mann, if you remember him, he's Armada Medical. He's a home health care. He was in X Team back years ago. And he runs a first class, and he's an accredited business. So if you're going to put somebody in charge or in your home with your parents, they can't speak or whatever, why would you not check bbb.org? So I hope in the future the state can, and we're in every state, so we've been around as a nonprofit. We're an easy person to partner, and I hope that maybe Virginia can lead in that moving forward, and then every state can take it. Do you know anything about can you speak about the Attorney General over the last couple of years? Has he handled things well? Has he taken cases with the nursing homes and stuff? Or
One of the things that really impressed me about the Attorney General is his involvement in fighting the pandemic of fentanyl use. And one of the things that we're most proud of, but it's really been a full court press from the First Lady's office, from the Office of the Attorney General, from the Governor's office, from VDH, from DVHDS, which is the Department of Behavioral Health, and getting more naloxone into communities, getting education in the communities, really getting awareness into communities of the effects of fentanyl. And it's so many times people take fentanyl and don't even know they're taking it. It's hidden in another drug that they think they're taking. And because of the collective efforts of all of those individuals and so many more, compared to several years ago, we're almost 60% fewer fentanyl deaths in Virginia this past year. And that a lot of the awareness from the governor's office and from the first lady's office or the state agencies, the office of the attorney general have been instrumental in that.
And the Narcan has saved a lot of lives. I don't know
Exactly.
that stat. We don't talk about that much because it's success. But and Jason, his team has been out there. I've attended events with his office, Better Business Bureau and the Attorney General work very closely together. So he has done a good job.
Yeah, the Revive training gives you 2 doses of naloxone. I've got it in my glove compartment. You likely have some here. Naloxone is the name. Narcan is the name brand. Naloxone is the drug. And I remember the first time I administered Narcan, it was in 2013, and it was this was I'm not sure if I mentioned in this podcast that being an EMS provider for
It was not in this one. Go ahead. Yeah.
So I've been a volunteer.
Shout out to
Tuckahoe Volunteer Rescue Squad. So that's where I got my start into the medical environment. As a volunteer EMT and a volunteer firefighter when I was in college. But in 2013, I was studying to become a medic. And I remember the first time I administered naloxone, it was a woman that had overdosed on a narcotic that she was legally prescribed, but she had had some alcohol at the time. She had a broken arm and she had a cardiac arrest event. And we were fortunate to be able to administer naloxone. That was the first time that I saw naloxone's effect. And it is incredible. Somebody is not breathing, their heart is not beating, and you're able to give a drug and then bring that individual back to life. And she, to my knowledge, because we were able to speak with her after, had no deficits at that. So naloxone is an incredible drug that is much more widely used in communities now, and it's saved an incredible amount of lives.
And one more business question.
No more business.
Okay, so you're wrapping up. Anything else you wanted to add that we did not talk about? Nursing homes, clean water. My water tastes terrible, by the way, but nothing you can do about that. I won't complain. I have a filter system at home, so I'm getting better.
Well, Christopher, thank you so much for joining us and for being on BBB Sharing. Everyone, if you're watching on BBB Central VA YouTube channel, please make sure to like, share, subscribe, and comment down below. And if you're listening on Apple Podcasts, RSS.com, or Spotify, please follow us. Thank you.
Thank you very much.